How long is influenza contagious after symptoms start? Imagine catching the flu and wondering just how long you might be spreading it to others. The truth is, influenza is usually contagious for about 5 to 7 days after symptoms begin. The highest risk of passing it on is during the first 3 to 4 days when your body is shedding the most virus particles. This period is when you're most likely to transmit the virus through coughs, sneezes, or talking. Interestingly, people can start spreading the flu about 1 day before they notice any symptoms. That means even if you feel fine, you might still be contagious and unknowingly pass the virus to others. This pre-symptomatic spread is part of what makes influenza so easy to transmit, especially in crowded places or close contact settings. For healthy adults, the contagious period generally doesn't last beyond a week. However, some groups, like young children or those with weakened immune systems, can shed the virus longer. In these cases, they might remain contagious for 2 weeks or more, because their bodies take longer to clear the virus. The influenza virus mainly spreads through tiny droplets released when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of nearby people. It can also spread by touching surfaces contaminated with the virus and then touching your face, especially your mouth, nose, or eyes. To sum up, you start being contagious about a day before symptoms show up. You are most contagious during the first 3 to 4 days after symptoms start, and in healthy individuals, this usually lasts about a week. But for some, especially children or immunocompromised people, it can be longer. Remember, the incubation period, which is the time from infection to symptoms, is typically about 1 to 4 days. Understanding these timelines helps in making decisions about staying home and avoiding others to prevent spreading the flu. Always consult healthcare professionals for personalized advice, especially if you or someone in your family has a weakened immune system or other health concerns. Following good respiratory hygiene, getting vaccinated, and staying home when sick are key steps to reduce the spread of influenza. This information is based on guidance from major health authorities and current scientific understanding of how the flu spreads and how long it remains contagious.